Welcome to this advanced demonstration of hand hygiene and aseptic technique, the foundation of all infection prevention. Every nurse must master these psychomotor skills precisely because a single break in asepsis can introduce pathogens, cause life-threatening infections, and compromise patient safety. We begin with medical asepsis, progress to surgical asepsis, and conclude with maintaining a sterile field using current evidence-based standards. Start with medical asepsis, also called clean technique. The goal is to reduce and control microorganisms. Perform hand hygiene before touching a patient. Before clean procedures, after body fluid exposure, after touching a patient, and after touching patient surroundings. Use soap and water when hands are visibly soiled or after caring for patients with spore-forming organisms such as Clostridioides difficile. Wet hands, apply soap. Scrub all surfaces for at least 20 seconds, paying attention to nails, thumbs, and between fingers. Rinse thoroughly and dry with a clean towel. Use the towel to turn off the faucet. For alcohol-based hand rubs, apply the recommended amount. Rub all surfaces of the hands and continue until completely dry. Never wipe excess off. Rub time must be at least 20 seconds. Medical asepsis also includes clean gloves, environmental cleanliness, proper waste disposal, and preventing cross-contamination between body sites. Now move to surgical asepsis or sterile technique. The purpose is elimination of all microorganisms from an area or object. Begin with surgical hand antisepsis if required, scrubbing from fingertips to elbows for the time recommended by guidelines. Keep hands above elbows and avoid touching anything non-sterile. Sterile glove application requires precision. Open the sterile package by touching only the outer edges. With your non-dominant hand, pick up the inside of the dominant glove. Keep fingers inside the glove while pulling it on. Then, slide the gloved dominant hand under the cuff of the remaining glove, touching only the exterior sterile surface. Once both gloves are on, keep hands above the waist, in sight, and away from your body. A single touch of any non-sterile object requires immediate regloving. Creating and maintaining a sterile field requires strict cognitive and psychomotor attention. Open the sterile drape by holding only the corners. Lay it on a clean, dry surface. The 1-inch border around the drape is always considered contaminated. Never reach over a sterile field. Reach around it. Sterile objects must remain above waist level. If an item's sterility is in doubt, consider it contaminated. Liquids must be poured carefully, without splashing, from a height of 4 to 6 inches, with the label facing upward to prevent dripping over the printed surface. Maintaining sterility means constant vigilance. Airflow, moisture, and movement are common sources of contamination. If sterile gloves touch moisture, sterility is lost. If the sterile field becomes wet, replace it. If a patient coughs or sneezes over the setup, the field must be re-established. Avoid rapid movements that disturb air currents. Keep non-sterile personnel at a distance. Always face the sterile field. Turning away risks contamination. During procedures, keep sterile instruments on the sterile field and handle them with sterile gloves or sterile forceps. Do not allow sterile items to cross over non-sterile zones. Watch for glove tears, accidental brush contact, or exposure to contaminated surfaces. If contamination occurs, stop immediately, correct the issue, and rebuild the field. Aseptic technique is not a checklist. It is a mindset. Nurses must anticipate contamination risks, think ahead, and protect the field as if the patient's life depends on it, because it often does. Central line insertions, wound care, catheterizations, and surgical dressing changes all rely on flawless asepsis to prevent bloodstream infections, sepsis, and complications. Conclude by integrating safety. Perform hand hygiene after removing gloves. Discard contaminated supplies properly, and document any sterile procedure, breaks in technique, and corrective actions. Mastery of hand hygiene and aseptic technique is a professional promise to protect patients with every touch.